public safety bill we will vote on this session. Here it is. Mental health is a major public safety issue. And I say that not because every person who has a mental health condition is a public safety threat. That's not true. Lots of people have mental health conditions and are not public safety threats. And it's not because everybody who commits a crime has a mental health condition. But for those of you who served on the Judiciary Committee, we heard from the Department of Corrections the data. And depending on what mental health diagnosis you're talking about, the data is that the prevalence of that mental health condition in our correctional system is 3 times or 5 times or 10 times as much as exists in the general population. There is a significant correlation between mental health problems and public safety. And too often we fail to deal with these issues while they're still in the community. And so as a result, we have over 2,500 inmates in our prison system today who have severe mental health conditions. That's just the fact. That's what Dr. Deal told us. And in community corrections, we have over 8,000 people in the community subject to supervision who have a diagnosed mental health condition that requires ongoing treatment in addition to their other criminogenic needs. So this is a big issue. It's also a public safety because of what happens with suicide in our state. Before the cut, after cut, after cut to our mental health system, Iowa had too many, but if you go back a decade, we had about 300 suicides every year in the state. Last year, or the last year for which I have the data, 2011, 420. More people dying from suicide than die in car accidents. The single leading cause of death of young people in our state. Is that an accident when you've had cut after cut after cut after cut to our mental health system? When you have community providers telling me we can no longer do the outreach that we'd like to do because if we do the outreach we'd like to do, guess what? We don't have the funding to provide the services for all those people. That's bad. That's a bad place to be in when we've cut it so much that you have people not doing the outreach that they know they need to do for suicide prevention and for public safety because they're not sure they can handle the additional volume that that would generate. I know there are going to be people who don't like it when I say this. I'm going to say it anyway. After Sandy Hook, Iowans expect us to do something. After Sandy Hook, Iowans expect us to do something, and this is a bill we can pass. We have a cash surplus of approaching $900 million. Can't we take a fraction of that, a small fraction of that, and put $42 million on a one-time basis to make sure our mental health system can get through this transition? Small price to pay. A small price to pay for something that is critically important for our families and our neighborhoods and our schools and our communities, like Senator Hatch said. These are the resources that are necessary to prevent bad outcomes from happening. Madam President, I strongly urge my colleagues to support Senate File 440. Thank you.
You're welcome.